Okay, welcome back to today's webinar on BioFlex Personal Therapy System for muscle strains. My name is Dr. David Kunashko. I'm a chiropractor, Director of Education and Training here at Meditech International. Of course, we manufacture BioFlex laser therapy systems, and we also have the world's largest low-level laser therapy or photobiomodulation clinic in North America. So the topic today is on muscle strains. Again, do a little bit of housekeeping before we actually get started. You can ask me all the questions you want. However, I will not answer them until the very end of the webinar. So feel free to type them in as we go along. And at the very end, I will definitely address those questions. You can also email me. My email will be at the very end of the session today. So I do 2 streams of webinars every month. I do a webinar for our professional systems, geared a little bit more obviously to clinicians that have our equipment, or perhaps are interested in our equipment. I also do a webinar like today's webinar on the personal therapy system, our home system, geared a little bit more obviously to the general public as opposed to clinicians. However, a lot of clinicians listen in because they also use the personal system for rentals for their patients, or it's additive treatment as well. So we have kind of 2 audiences typically listening in. These webinars are always free. They're always recorded so that if you're not able to attend or you want to rewatch, binge watch on my webinars, of course, then you can do so by opening up the link that we will send you within a week or so of the broadcast date. So it is recorded and you can watch it again whenever you'd like to. So that's about it for the introduction, I believe. A little bit about me briefly. As I mentioned, I'm a chiropractor. I've been practicing close to 30 years. And I got interested in laser therapy about 10, 11 years ago when I had a couple of serious injuries, one falling off a roof, long story, but ended up having to stop to practice for quite a while. And during the process of rehab, I knew about Dr. Khan and ended up going there for treatment. And it really helped. I wasn't sure why it helped. And I decided to learn more about it and eventually ended up working with Dr. Fred Khan, who is still the active CEO of Meditech and at the clinic, and of course is educating the general public and clinicians on this amazing type of technology. So the agenda today, as I usually do for these personal therapy systems, is talk a little bit about them, how to use them, that kind of thing. The general effects of, I'm going to use the term photobiomodulation. You can use the term phototherapy, low-level light therapy, low-level laser therapy. There's many terms, but the accepted term now for research is photobiomodulation. And so that's because you don't have to use a laser diode or specifically to get this effect, as long as you have correct parameters. Of course, in the home systems, we don't use a class 3B laser because that's a restricted device. And it's restricted to healthcare practitioners. So, however, our equipment, even the professional equipment, is we also have these high-powered LEDs that are part of the equipment, as well as laser diodes. So in the home system, just the LEDs, and the professional equipment, a combination of the 2. Then I'll talk a little bit about skeletal muscle and how it heals, and how specifically photobiomodulation would help muscle strains. A little bit of research, there's lots out there, but I just want to touch on a couple of topics so you can understand what it is laser therapy is doing. Again, I'm going to use the terms interchangeably. Sometimes I'll say laser therapy or photobiomodulation or what have you, same thing. And then specifically how to use your equipment I'm going to give some examples of common muscle strains to give you an idea of how you would use the equipment, along with how many times you should use it, all that kind of information as well too. And then of course we'll have time for Q&A at the end. So we actually manufacture 2 different types of personal therapy systems. One's called the BioFlex 120. The other one is called the BioFlex 180 or the P180 or P120. They look pretty similar. The controller is similar. The main difference is the actual light array. And so these light arrays have 2 different sizes. The 120 has 120 high-powered LEDs. They're referred to as superluminous diodes because they have narrow band and are fairly powerful for LEDs. And then the BioFlex Personal or P180, 180 diodes, slightly increased in power density, and of course increase in surface area. So depending on your stature, depending on what you're treating, you might choose a smaller one or the larger one. And if you're not sure, then certainly when you're talking to us, any of the account executives, they can help you out with specifically which one might be best for your condition or body size or what have you. The controller is the main piece of equipment that is able to provide all the different protocols. So it's embedded software, has a series of protocols. You can see they're starting from the face, neck, shoulder, upper back, hip, all the way down to the ankle and the foot. These protocols are actually all based on Dr. Fred Kahn's protocols for the professional therapy systems. He altered them a little bit so that he squeezed out, instead of 3 levels, 4 levels at varying intensities and stimulations, because with this equipment, unlike the professional equipment, you can't customize or change it. There's not the capability because you would need a computer for that, basically, right? So what he did was he modified the protocols and adjusted them for this format. And actually I have a webinar in April that I'm going to explain all these protocols, sort of the differences between them. And so you understand a little bit more why you're doing what you're doing, right? So look out for that webinar for next month. The bottom of the controller has some features that you should all be familiar with. Sometimes I get emails and people don't understand the treatment stage or even the buttons or what have you. So obviously left lower button is a power button to turn it on and off. You do that once it's plugged in, and then you can choose the anatomical area that you want to treat, the knee, foot, ankle, what have you. Click on that, then hit the select stage. So the stage is starting from stage 1, 2, 3, and then 4. And it's an increasing power, you might say, intensity, energy density, power density, all these different things. I'm going to explain all that actually in next month's webinar. But it's important to understand that these stages are designed to be used in a certain way, and I'll explain that specifically for muscle strains during today's webinar. The treatment array, this is showing you the P120. You can see it's sort of a flexible silicone array. It's designed to bend and curve and make contact with the human body. However, you do need to be somewhat careful. You don't want to like sandwich it and crush it kind of thing, because like silicone, it's eventually going to fatigue. So take care of it. Try not to abuse it too much. And I'll tell you how to clean it at the end of the webinar as well too. This particular one, the P120, has 120 bi-color superluminous diodes, meaning that each diode is able to emit both red wavelength at 660 nanometers and infrared or near infrared wavelengths at approximately 840 nanometers in wavelength. So what are the generalized effects of photobiomodulation that we're interested in for muscle strains? Well, specifically, we're interested in collagen production. And you might wonder, well, why would you be interested in collagen production? And that's something I will touch upon very shortly. Of course, we're interested in muscle regeneration and helping muscles repair themselves, obviously, because that's the topic of today's webinar. And we're also interested in inflammation and edema to reduce those two things as well. So really, this is what we're looking at specifically to reduce and improve upon with photobiomodulation for muscle strains. The next 2 slides I usually talk about every webinar because they're really important. And that's because the way photobiomodulation works is really fundamentally two different ways. One is directly, so in other words, if light of the correct wavelengths is absorbed directly by an injured cell, then you will have a direct effect. So if I have muscle tissue that's injured or strained and I can get light directly to it, then I'm going to be able to help the inflammation inside the cell that affects the mitochondria, which I'll talk about again shortly, and then it will actually help those cells to heal quicker. Now the problem, of course, is that some muscles lie very deep. And those deep muscles aren't accessible to light because light can only travel so deep in the human body. And how you would approach getting light to those tissues is through the blood. You can say blood, bone marrow as well, but really, because we're not really getting much light into bone marrow, we're actually stimulating more blood. So these large arrays are meant to treat a large volume of blood that's circulating underneath it. Now, some of you are aware, of course, blood contains red blood cells or red corpuscles and white blood cells and platelets and stem cells. It's the white blood cells or the immune cells that are critical for healing of muscle injury. Of course, we all have heard about the cytokine storm with COVID infection, and that's mediated by white blood cells in your blood. They respond to the infection, to the viral infection. Of course, here we're talking about muscle strains, but a very similar process as far as how the body reacts to inflammation. So when you treat a large volume of blood, then you stimulate these white blood cells that travel in the circulation to all the areas around that you're treating, including deeper areas that the light can't directly get to. And so these stimulated cells, the stimulated immune cells and stem cells, will actually then help the injured cells recover and repair faster. So you can have a direct effect if you can get light directly to the tissues, and you may also have an indirect effect that is more likely when you're treating deeper muscles that are injured. Now, there are three types of muscle cells. The skeletal muscle cell that everyone is familiar with because that's what allows you to move your joints and body parts. That's the one that we're interested in talking about today, but you also should be aware there's smooth muscle cell. These are muscles that control, say, GI motility, so contraction of your stomach and your intestines and so forth, and also surrounding arterioles and arteries to allow them to contract and dilate. And of course, we know about cardiac muscle. I don't think we need to explain what that does. A skeletal muscle fiber or a cell is a elongated cylindrical looking cell. And it has a outer layer called the sarcolemma. And inside there's of course a nucleus, and there's also many mitochondria. Now, mitochondria produce or generate energy. This is called the aerobic respiration. So for example, when you breathe in oxygen. When you eat, you take in and you break down food into glucose. Then this drives aerobic respiration that allows the mitochondria to produce energy in the form of ATP. And this ATP allows the muscles to contract. Inside a muscle fiber are tens of thousands of something called myofibrils. These myofibrils contract and relax, allowing the muscle cell to contract and relax and move your body parts around. If you were to do a cross section of the muscle fibers, many muscle fibers, you would see each muscle cell. You can see that one muscle cell I'm circling right here, and then that's surrounded by a membrane, and then you have another one and another one, and then you have dissecting blood vessels that are supplying all these muscle fibers. And on the outside of every muscle fiber or cell are these really interesting cells called satellite cells or stem cells. Specifically, they're myosatellite cells. Now, these are stem cells. You may have heard of stem cells before because you've heard of stem cell therapy. You may have heard of stem cell injections or what have you. Now, stem cells are immature cells, and they can turn into different types of cells. So when we grow as a fetus and all these cells are dividing, basically these are cells that are triggered by the genetics to turn into, a muscle fiber or a bone cell or what have you. These satellite cells in the muscle cells, they actually don't do anything until there's an injury. And when there's an injury, they're triggered by the inflammation and the secretion of the white blood cells that sort of are attracted to the injury site, and they trigger these satellite cells to repair and regenerate injured muscle cells. So they're critical in actually helping you repair a muscle strain. So really how this works is You have a muscle fiber. On the far left is an example of a muscle fiber. You have blood vessels that surround it, and you have these quiescent or quiet satellite cells or stem cells, the green blobs. So what happens is when you have an injury, then you get an inflammatory response and you get immune cells are triggered, as I've already mentioned, to start this process of satellite cell proliferation. These stem cells now will proliferate and differentiate into what's referred to as myoblasts or young baby muscle fiber cells, and they can regenerate and repair skeletal muscle fibers. So basically you need the blood to supply and be stimulated. You need these satellite cells or stem cells to be to start to proliferate and be stimulated to turn into eventually the repair process and regenerate skeletal muscle fibers. So that's really how it works. So if you're looking at real muscle tissue, this is what it looks like. A resting muscle, you can see, as I've shown you earlier, cross section, all of these skeletal muscle fibers wrapped around by little sheaths of fiber, of collagen actually. What happens is when you have an acute injury, so let's say you've pulled a hamstring or you've strained your lower back, within the course of one day, you start to get what's called an inflammatory exudate. It's very quick, and the blood vessels gets attracted to allow the immune cells and the white blood cells to go into the area. And then that occurs very quickly, and you build up this inflammatory process over the first day or two. And then over the next few days, you start to get regeneration and repair. And then eventually, somewhere around 10 to 20 days later, after the initial injury, you get growth, remodeling, and maturation of the skeletal muscle fibers. You can also think of this as if you're lifting weights or doing an activity you haven't done in a while, and you're using muscles you haven't used in a while, and the next day you have quite sore muscles, not debilitating, but it feels quite sore. That's called delayed onset muscle soreness, or DOMS. And so typically when you lift weights or do an exercise, you give yourself a day or two of recovery, because this exactly is what's happening, is you get this injury process going on. Now, when you're doing like muscle or lifting weights or what have you, you don't have as much injury process usually, so it's not going to take as long to repair, but it's a similar process that's going on. And yes, you can actually use photobiomodulation or your personal therapy system. I'd recommend if you're doing weights, then I would apply it before, maybe up to an hour, 2 hours before your weightlifting, then do your weightlifting, and then treat within a few hours of doing your weightlifting, and you'll have less delayed onset muscle soreness. Now, after the injury, the muscle undergoes very distinct set of healing phases, as I've already kind of shown you the pictures. First is degeneration and inflammation. This occurs very quickly within a few minutes and continues for up to 1 to 2 weeks post-injury. And during this process, you start to get regeneration that starts to occur within a week to 10 days. Now, this is normal process. If you add photobiomodulation or laser therapy, you actually accelerate these times. So regeneration occurs much sooner than just 7 to 10 days. But normally without photobiomodulation, it occurs 7 to 10 days, and it will peak at a couple of weeks and it starts to slowly decline after a few weeks until you get tissue healing. So from start to finish, you can look at a muscle injury taking up to 4 weeks, sometimes as long as 5, 6 weeks to repair completely. Now, one of the things that we're trying to really understand about muscle injury is fibrosis. Fibrosis is exactly what it sounds like. It's actually scar tissue that builds up in the damaged muscle tissue. And this is occurring 2 to 4 weeks post-injury. Now, the problem with fibrosis is that if there's too much fibrosis, you'll get too much scar tissue intertwined in the muscle fibers. And this leads to less functionality of the muscle tissue. So in other words, it makes it weaker, which means that you're prone to re-injuring that same area of muscle if you overdo it again. So the goal is to reduce the amount of fibrosis and reduce the occurrence of re-injury. So the phases, once again, the acute phase where you start to get the blood clot and you might see a hematoma or a big bruise, right? And then you get the subacute phase, you get the hematoma declining, you're getting this fibrosing tissue going on. Then you get into the chronic phase after a few weeks, the tissue fibers are becoming more organized, regeneration, and eventually you get fiber regeneration and remodeling over a period of 3 to 4 or 5 weeks. So injured muscles can initiate regeneration very quickly, but this whole healing process is usually, it can be very inefficient. And as I mentioned, it can be hindered by excessive scar tissue formation. So there's lots of things you can do to reduce this. One is, of course, laser therapy. Another one is very gentle stretching and very specific exercises. You don't do it right away, but you start to engage that as your tissues are healing. For that, I recommend you see a healthcare professional like a chiropractor, a physiotherapist, massage therapist, you know, those kinds of folks, and they can definitely help you out with that as well too. So the formation of the scar tissue is part of the end process or the end product of muscle repair. So as I've mentioned, it really contributes to the tendency for muscles that have been injured to have another muscle strain. So if you look at this as a schematic, initially you have degeneration and inflammation, and then you're trying to maximize the amount of muscle fiber regeneration, and you're trying to minimize the fibrosing and the scarring. So if you were just not to do anything at all and you have an injury and you leave it alone, yes, it will heal, and yes, you'll be fine afterwards, but unfortunately you won't be minimizing the fibrosing, and nor will you be maximizing the regeneration of your muscle fibers. So the idea here is that you treat it properly, right? You treat it with laser therapy, you treat it with the appropriate exercises, and you treat it with some other techniques that can be used to really achieve a much better way of healing than if you just left it on its own. So what are the effects of laser therapy on muscle healing? Well, first of all, of course, you have to get the light to the area, in and around the area, so that makes sense, right? And this light will then activate these myosatellite cells or stem cells and help them proliferate and repair and regenerate. It also stimulates platelets in the blood to secrete very specific growth factors and what's called vascular endothelial growth factors for blood formation. So basically it helps you secrete these specific chemicals that accelerate the healing, and it increases blood supply by increasing blood formation. Not red blood cell formation, I should say capillaries and branches of new capillaries in the damaged area. The more blood you have to the area, the more complete and the faster the healing that will occur. So by consistent treatment of this muscle injury, you will actually accelerate the healing process by these different processes. A little bit of research, I just mentioned a couple papers here. One is on low energy laser irradiation promoting the survival and cell cycle entry of skeletal muscle satellite cells. Remember I said satellite cells? Those are the stem cells. Now, just so you have an idea of what's going on here, what they did was they used laser, they used red laser, and whoops, my phone is on there. I don't know why my phone's on. They had a control muscle fibers, so no laser light. They used red on some other fibers, and then they counted the number of active stem cells. And you can see these little, it's hard to see, but these little brown blobs, those are stem cells. So they looked at the two fibers, they let them grow for a certain time frame, then they excised them, they looked at them, and the ones that were treated with the laser actually had up to 4 to 5 times more stem cells than the control. Here's a really cool picture that shows you that. So on the left is the control. You can see those little blue blobs, those are the stem cells. And then if you look at the laser treated, it doesn't take a genius here to look, there's a lot more of those stem cells compared to the control. So that particular paper, they concluded that the laser therapy or laser stimulates the cell cycle entry and the accumulation of satellite cells. And for the first time ever, now this paper goes back a few years, but it's quite a great paper. And it says the first time ever, they were able to show laser therapy promotes the survival of skeletal muscle fibers and their adjacent cells, as well as cultured myogenic cells or muscle cells. And these cells oftentimes undergo what's called apoptosis or apoptosis, and this is cellular death. So basically what happens is when you have an injury and you do nothing, the surrounding cells are triggered by the injured cells, and some of these cells will actually die, and you'll have a poor repair process. So this light therapy seems to reduce the number of cells that actually die or undergo cellular apoptosis. So it has this beneficial effect as well to reduce the amount of cells that actually die because of that injury. Second paper is a systematic review. A systematic review is they look at a whole bunch of papers, research papers, and they analyze them and they draw conclusions. So that's what a systematic review is. It's more of a powerful research paper as opposed to just a single research paper. So this particular one published, they concluded that the main effects of LLLT, which is low-level light or low-level laser therapy, was a reduction in the inflammatory process, the modulation of growth factors. Remember I mentioned growth factors by platelets, and the regulatory control factors of muscle cells were also modulated, and an increase in angiogenesis, which is a fancy way of saying more capillaries or branches of capillaries. So as I've already mentioned earlier, some of the research to back that up. So the studies analyzed and demonstrated the positive effects of laser therapy on the muscle repair process, which are dependent on specifically the parameters and of the wavelengths and irradiation. So these findings suggest that laser therapy is an excellent resource to help the treatment of skeletal muscle injuries in the short term. I think I'm going to go over time just so you know, guys. Okay, so let's get into it. Muscle strain, hamstring, very common injury. This is what they look like. Now, usually a hamstring tear occurs in the upper portion of the upper thigh, the back of the thigh, near the gluteal fold. You'll see bruising that carries down. Now, the injury is up here, but the bruising also continues down here. So how you would approach treatment is use the hip protocol at the very top, right at the gluteal fold and over the area that's been injured, because there's lots of deep, thick muscle tissue there. So the treatment time's a little bit longer, 20 minutes. And then the lower section, which has less tissue damage and more just hematoma or bruising, I would use the knee protocol. Again, less time. You don't need as much time because you're not trying to drive the light and get as much light as deep as possible, because it's more superficial. The hematoma is relatively superficial. So you would do up to 3 placements, maybe 4, depending on how long your leg is, but you're going to concentrate more time over the affected muscle injury using the hip protocol, excuse me, and then using the knee protocol for over the hematoma. Another really common injury, man, I get calf strains. I used to get them a lot. Fortunately, I don't get them as often now. So again, you're going to apply 2 placements, maybe 3, depends on, again, the extent of the injury, and apply it over the injured area. I would use the knee protocol, so roughly 14 minutes per site. Okay. For a deltoid, which is that big muscle on the side of your shoulder, now the deltoid muscle actually has 3 parts to it. It has an anterior or front part, it has a middle part or lateral part, and it has a posterior or portion on the back portion of the deltoid. It's a really large muscle. In order to properly treat a deltoid muscle strain, you'll want to treat the front part using the shoulder protocol, the middle part or the lateral part, and the posterior part or the rear part of the deltoid. So 3 placements overlying the area. And again, I would use the shoulder protocol, which is approximately 14 minutes per placement. Last example, I'm not going to obviously go over the entire body. I mean, I think you could kind of get the idea. For a low back strain, you'll want to apply the arrays on the side of the injury. So usually it's right or left sided. You can tell that just where you feel the pain, obviously. Now, if it's both sides, then you're going to treat both sides. So you're going to do 4 placements or however many it takes. But in this case, if we back it up a little bit, the injury's on the right side. Roughly you can see here just above the hip area and sort of the entire lower back. So you would apply one array just lateral to the spine where the muscles are coming out to wrap around, and then just lower to that, again covering the muscles that are involved and using the lower back protocol. So roughly about 30 minutes of total treatment time. Again, that may increase or decrease depending on the extent of the actual muscle strain. Now, as far as treatment plan goes, you can initiate the use of the personal therapy system within 24 hours of an acute muscle strain or muscle injury. Treat once a day. If it's really bad, you can squeeze out two sessions, one in the morning and one maybe early evening kind of thing. But don't overdo it. You can do that maybe when it's really acute for the first few days or what have you, but then just treat once a day and start with using level 1. So this is the first time I'm going to talk about these levels. Level 1 is the sort of the lowest form of energy. And you may wonder, well, why am I not using level 4, the highest amount of stimulation? You have to understand here is that these are designed and have been utilized by Dr. Khan for 30 years. And the reason why we say level 1 is that in his experience treating tens of thousands of patients, that this level 1 is most effective when you have this acute kind of scenario going on. Then after 4, 5, 6 days thereabouts, you can then go to level 2. You should be treating about every other day, so maybe 3, 4, maybe 5 times a week thereabouts. You don't have to treat every day, but certainly every other day would work quite well. And then as things are, again, healing well, feeling better, you can then jump up to level 3 after you've done about 10 or 12 sessions. Now, you can maybe even go a little bit sooner to level 3 if you're plateauing. In other words, if you're finding that you're not getting better as quickly as you'd like or what have you, give it a bit of time. But if it's not helping at level 2, then you can progress to level 3. You may go to level 4, although it's unlikely. But if you need to, you can also go to levels 4 as well. For some reason, I mentioned like as far as these levels go, it's important to understand that don't start at the highest level, right? You want to start at the lowest levels. So ensure that you do that and just don't jump up too high at all, okay? So allow the array to emit both red and infrared light before moving it to the next position, and try not to overlap the array when moving it from one position to the other position. The BioFlex Personal Therapy System is designed to make direct contact with the skin. Don't use it over clothing or a bandage or what have you. So make sure it's direct contact on bare skin. And it should have firm contact, so use a strap to hold it in place or some kind of light beanbag or light object to kind of push it down into the skin. Make sure you're removing any creams or lotions, that kind of thing. It can sometimes block light from getting into the skin. Remember that these are very high intensity LEDs, but they're not laser diodes, so they don't pose a risk to your eye, so you don't have to necessarily protect your eye. Don't treat over any areas of known carcinoma, for example, skin cancer. If you're using a photosensitive medication like Accutane or a certain type of antibiotic, most of the time they interact with ultraviolet wavelengths. However, if you're not sure, what have you, you can ask your doctor or the pharmacist. But typically, the wavelengths that we use, the red and near infrared wavelengths, it's not likely to interact, so you should be okay. Clean your light array after each use using a medical grade sanitizer. You can use something called Sanacloth or ACL staticide, or even a solution of diluted alcohol, but don't use, I wouldn't use domestic brand name, like, I don't know, Lysol brand or whatever, because they have perfumes and other things in it that aren't necessarily great for the silicone, so I would avoid those. Okay, so I'm going to take some questions now. Just so you're aware, we have a new website, and on this website, you'll find lots of different good bits of information. If you go to events, you can see that there's you can browse upcoming events, and we also have a new category called on-demand basic and advanced training. Right now, I just have one advanced training up there. I did one a couple weeks ago on the lumbosacral region, so you can actually download this and listen to it whenever you'd like to, and take the certification test and become certified in the lumbosacral region. So that's now up and running on our website. Soon I'll have other trainings. Some will be free, some will be pay-per-view as we proceed and do them and broadcast them throughout this year. So pretty easy to navigate. I encourage you to look around. We have lots of new information on the website. I think you'll definitely find it interesting. Okay.